Hi, folks. Get started in a second. Let me just set everything up. I apologize for being a little late. Hi, folks. Get started in a second. Let me just set everything up. Sorry about that. Little delay on the Facebook Live feed. All right. So welcome back to our weekly COVID review. Apologize for last week. It was move-in day for the college, and my stepdaughter was moving in, so I was otherwise predisposed. And the beginning of the semester is always kind of chaotic, so I apologize. I am going to try to make these a little bit shorter because I have my workload increases quite a bit since the semester started, so I'll try to make these shorter. I don't know about today. I have a lot to cover today. But yeah, in the future, I might try to make it less than an hour, maybe 45 minutes. I think that's a better length anyways. So anyways, let's talk about this week. So as usual, this will be on Facebook Live. So if you have any questions or comments, pop them up on the chat on the Facebook feed, and I'll try to get to them. Otherwise, if you're on Facebook and you want to get on Zoom, DM me for the link. I'll send that to you. If you are on if you're on Zoom, you can always throw up questions on the chat. I'm more than happy to address them. All right. And of course, if you're missing this, I will have this up after it's over. I'll have it up on my YouTube channel, so you can catch it on there. All right, so let's get started. Like I said, lots to cover today, lots of news, especially since it's been a couple of weeks since my last one. So globally, we're still in the midst of our fourth wave, I think. You can see that the numbers aren't increasing quite as much as it was earlier. There's a few countries, particularly South America, that has improved quite a bit. However, there are other regions of the area that are seeing quite a surge. So we're right around 650,000 cases a day, which is about an 8% increase since 2 weeks ago. So it has slowed down a little bit in the last few days, but it's still going up. So the hotspots right now, the biggest hotspots really is the US. We're seeing a significant surge, of course. Western Europe is still a pretty hot spot. It's a significant hotspot. You can see areas of Central Asia, for example, Mongolia, Iran, and Kazakhstan are also seeing an increase. Malaysia continues to really struggle with numbers, as is the southern part of Africa. You can see that Botswana has some really serious numbers as well. And regions of Central Asia, like I think I mentioned, Turkey, Greece, Eastern Asia starting to go up again as well. So definitely some hotspots. Good news, though, is the numbers in South America are continuing to improve. So that's really good news for a region that has really struggled with COVID throughout this pandemic. I mean, they haven't been able to catch a break. All right. So to hear the details as far as new confirmed COVID cases. So the US is now number one, leading the way again in number of new cases per day. But you can see that regions of Asia, Europe, and Africa are also on that list. So you can see by region. So you see that Asia's peaked a little bit and their numbers are going down. I think Indonesia's numbers have improved so that Asian numbers are starting to go up. However, North American numbers are continuing to go up, and I don't foresee that changing much in the next few weeks. European numbers are kind of at a plateau. I think a lot of us are looking at the UK, seeing where they're kind of they're kind of going to be really interesting to watch in the next few weeks, is to kind of try to predict where American numbers, where US numbers will go. Right now, they're at a plateau. Western European numbers have improved somewhat, but Eastern European is starting to surge. Eastern Europe is starting to surge. South American numbers continue to go down. Africa is at a plateau. There are regions of Africa that are doing better, but others that are doing worse. But overall, African numbers are still unstable because of, again, the data coming out of it is really unclear. And of course, Australia and New Zealand, well, we'll talk about Australia and New Zealand in a second. So you can see daily confirmed cases, the US leads the way at about 140,000 cases a day, new cases a day. So we're not doing well at all. And I don't see those numbers changing significantly in the next few weeks. It's hard to predict with Delta things, I'm at a point where I'm not quite certain what's going to happen. Are we going to plateau at some point and start to decline, or is this going to keep going up? It's hard to say. Iran is second now, so Iran's really struggling. Then India. India, of course, remember, India is 1 billion folks, so yeah, they still haven't fully recovered from their previous surge. They're at a plateau, relatively still pretty high. Brazil is doing better, but not as well as the other South American countries. The UK is fifth, and you can see the rest of the list here. In terms of per capita numbers, Africa, Asia, and Europe lead the way. Here's the details. So you can see that South American numbers are doing much better. They are no longer number one. For the longest time, they were number one. North America actually is number one. We're at about 300 new cases per million people. That is not a great level at all. And it's continuing to go up. That slope is very, very steep. And again, like I said, I don't see that changing anytime soon. Europe is second now. So South American, so this is indicative of two things. Number one is how bad North America and Europe are doing, but also the improvements in South America. South America is doing much better. Asia is plateauing a bit. Like I mentioned, I think Indonesian numbers are down a bit, so that's kind of affected. Asian numbers they're plateaued. Africa is also plateaued, but again, it's hard to tell with what's going on in Africa because the numbers are unreliable. And then you can see that Australia is struggling. It's really struggling right now, as well as areas of Papua New Guinea and Timor as well. So Australia's Oceania is struggling a bit. As far as countries, Georgia still continues to struggle. They're now above 1,000 cases per million per day. That is a high level. That's a really that's a significant surge. Dominica, which is a small island in the Caribbean, is second. They're struggling as well. Cuba is really struggling. They've been up here for a while now. The Cuban medical system, which by many measures is one of the best in the world, is really struggling right now. They are running out of supplies, they're running out of personnel, and really struggling with numbers. This is concerning. Israel is fourth now, and from a per capita standpoint, of course, it's concerning because Israel has one of the highest vaccination rates in the world, and yet they're still struggling. And this is how Delta has really changed the metric here. But remember, this is cases. With hospitalizations, they're doing better, but we'll get to that in a second. Then Botswana, Seychelles continues to struggle. And you can see some Eastern European countries popping up here, and they're starting to surge, unfortunately. You got Kosovo, Montenegro, Bulgaria is surging, Latvia, Lithuania are surging. So the whack-a-mole continues. So you can see the changes here. See Australia, Papua New Guinea have surged. Same with East Timor, in Oceania. North America is also, we're seeing increases in North America. And you can see that it looks like the wave has shifted from Western Europe and it's shifting more towards Central and Eastern Europe. So you're seeing some surges there as well. Africa, there are regions that are doing better and regions that are doing worse. Again, it's really hard to tell with Africa, given the unreliability of the numbers and the lack of testing infrastructure in Africa. So you can see the changes here. I mentioned Papua New Guinea, Kosovo, So you can see some Eastern European countries represent here: Bosnia, Albania, North Macedonia. So you're seeing Eastern European surges, as well as some regions in Central Europe. And the Caribbean is really struggling right now as well. So you can see Jamaica, St. Vincent, St. Lucia. So a lot of the smaller island nations of the Caribbean are really struggling right now. So region-wise, you see the U.S. numbers continuing to go up, mostly driven by one region in particular, and that is the South. The Southeast is really driving this. The rest of the country, yes, you're seeing increases, but not to the degree that we're seeing in the South, particularly Mississippi now, Louisiana, and of course, Florida. Canada is also going up, and it was inevitable. With the, even though there are strict restrictions across the border, it was inevitable that Delta was going to hit Canada. Will they fare a bit better because their vaccination rates are significantly higher than the US? We'll see. We'll see in the next few weeks. This is the situation in Central America and the Caribbean. So you can see the Cuban numbers. They've kind of 800 per a million is not great. And you can see they're kind of struggling right now, right around the 800 per million mark. Costa Rica, they were going down, but again, Delta hit, and so they're kind of fluctuating at a fairly high plateau as well. Honduras is going up. Mexico continues to go up. Mexico, I'm still thinking that Mexico is not testing nearly enough. I think this is really a huge underestimate because their mortality, death numbers are really, really high. So that's a concern. Dominican Republic is doing okay. Haiti, of course, Haiti was hit by another significant earthquake, along with the political instability. Now hurricane season is coming up. It's just not a good situation in the Caribbean right now, particularly Haiti. So those numbers are probably a significant underestimate because of all the other things that are happening in Haiti right now. Overall, good numbers in South America. You can see that significant declines everywhere. Brazil's kind of plateaued. Brazil has never been able to, they have fluctuated at fairly high levels. So we'll see how that goes. But the rest of the continent seems to be doing much better as of late. I don't know what the percentage of cases that are due to Delta is in South America. So that's worth watching. Are they going to be hit with Delta pretty soon? I don't know. I think their overall seroprevalence is really probably pretty high. They've had such high levels of disease for so long. I think a significant proportion of the South American population has some level of immune response to COVID. Whether it's through Delta or not is unknown, but will that protect them against a significant surge in Delta? Are we reaching that mythical herd immunity level, which we don't know, but we'll see in the next few weeks. But this is good news that it's continuing to go down, with the like I said, with the exception of Brazil, which there's a lot of explanations for that. Probably the most obvious one is that the Brazilian healthcare system has just been hammered, and the government response to COVID has been just abysmal. So this is Southern Africa. You can see that Botswana, again, the data is, you can see that the Botswana, it looks like a series of squares, and that's because the reporting out of Botswana is usually every week or so. And that's actually an issue. In fact, that's an issue that in the US that I'm going to address in a bit, the lack of timely reporting. It's hard to keep track. So that's why you see that, like, it's very linear, the numbers. South Africa, after a peak, then decline, plateaued, is now going up again driven by Delta. Looks like Namibia is doing much better than it was. That's good news because Namibia was really, really hammered hard. Unfortunately, they're going through a wave of mortality due to the surge. And because Namibia is very poor and they just don't have the resources to deal with the number of cases. So same with Zimbabwe and Zambia as well. So this is, again, that big square is from the Central African Republic. This is Central and Eastern Africa. And again, that tells you how unreliable the data reporting is out of some of these African countries. Again, just simply because they don't have the testing or the data infrastructure that some other countries have. And so it's really hard to, really hard to interpret some of these numbers. Rwanda actually has a very robust public health system, and their numbers have been actually quite good. I mean, in terms of testing, the numbers of COVID has not been great, but Rwanda numbers are much more reliable than some of these other countries. Same with Kenya. Democratic Republic of the Congo, again, they have very, very fragmented healthcare system, unfortunately. So those numbers are very unreliable. And that's mostly the problem with Africa. I think the numbers there are much, much, much higher than is actually being reported. But because of lack of testing infrastructure and lack of data infrastructure, it's really hard to see what's really going on in Africa. In some cases, the death numbers, the excess mortality is probably going to be a better number. But right now, the problem with Africa is they have a lot of concurrent outbreaks. For example, there's Ebola outbreaks in several parts of Africa right now. It's, malaria. It's kind of on the, it's actually still the wet season in Africa. So you have malaria surges, you have surges in meningitis. So you have all these other infectious diseases that are surging along with COVID. So it's really hard to sort that out given this data. West Africa, I'm a bit concerned. I'm seeing some really concerning numbers out of West Africa. So, looking at Togo, Senegal's numbers good. Mauritania was really surging, but it looks like it's going down. Now, keep in mind this x-axis. Remember, we're seeing countries with 800 or 1,000 cases per million, and this is only at 60. Again, I think this is a gross underestimate, but it seems like the levels are lower. But again, with countries like this, I'm more concerned about trend rather than the absolute numbers, because again, I think those are really underestimated by magnitude, but I think the trends are real, and that is concerning. You look at Togo, Ghana, Benin, Guinea, Ivory Coast, Nigeria, they're all seeing increases, again, driven by Delta. And these are countries that just have very low levels of vaccination. So this is, and very, and they don't have the hospital resources to deal with significant surges. So that's going to be a huge concern. Northern Africa, overall better. Tunisia is kind of fluctuating. Morocco seems to have peaked. Libya as well. So doing okay. Israel, like I said, is a concern because their numbers are so high, and they are the most vaccinated country in the world. But also, this may be due to robust testing. Israel tests a lot. And so they're probably catching most of their cases. So that may explain why they're seeing so many cases. And again, they're probably seeing a lot of infections, not necessarily symptomatic diseases. With Israel, it's worth seeing the hospitalization and death data. And those are much lower than this. And again, and I'll keep repeating this. We need to start differentiating infection versus disease. Because I'm afraid that the vaccines may not be as effective against infection, but it is. And again, all the data, I'll go over this later on in the presentation, all the data shows that the vaccines are still incredibly effective against symptomatic disease, hospitalization, and death. Okay, it may not be as effective against infection, right? And again, infection is simply that the virus is starting to reproduce in your body, and you may or may not be shedding virus. That's infection. Disease is when you start showing signs and symptoms. And that's with COVID, that's a really important distinction, because a lot of folks will never progress to disease, especially vaccinated. They may get infected, but they will never progress to disease. And so that's a really important distinction that the media is really not differentiating. And I think it's really, really important, because the vaccines may not be as effective against infection, but it is against disease. And so maybe we should stop talking about efficacy against infection. unless we're talking about transmission, because you can transmit if you have infection. Maybe we should start talking about disease. And against disease, it is still highly effective. I'll talk about this a little bit more at the end, because I want to talk about my thoughts about where we are going, what's going to happen in the future in terms of disease dynamics. So anyways, Iraq has seen a surge, but it looks like the rest of the Middle East is doing okay. Central Asia, Georgia numbers maybe peaking, I don't know, but that's awfully high. That's really, really concerning. They probably do have better testing in Georgia than the rest of the region. That may explain some of this, but it is still high and it's rising. So that's really the takeaway. When in doubt about the numbers, the magnitude, look at the trends. The trends usually aren't wrong. The numbers may be underestimated, but the trends are always a good indication. And that trend line is not great. Azerbaijan is seeing a huge increase. Azerbaijan, you probably know, Azerbaijan and Armenia was in a recent war together. So they're still struggling to kind of deal with COVID. Their infrastructure was not as good. Armenia is also seeing an increase. Kyrgyzstan is now seeing a decline, which is good news. Kazakhstan's kind of all over the place, but it looks like it's kind of plateaued. Same with Mongolia. Iran, I mentioned, they're seeing another surge. This is, I think, their fourth or fifth surge right now, and Iran has been struggling. And again, the struggles of Iran is exacerbated by the economic embargoes against Iran because of politics. So that's causing them to, they're struggling quite a bit because of that as well. Sri Lanka is seeing a significant increase, which is concerning. But the rest of South Asia seems to be doing well. Nepal surged again and is starting to go down. Bhutan saw a little bit of a blip there. Bhutan, of course, is a small Himalayan country that has been lauded for doing so well against COVID with so little resources. So they're continuing to do well. India numbers have plateaued at quite honestly at a higher level than we like to see. So they're still struggling with Delta in India. Bangladesh numbers are now declining again, so that's good news. Southeast Asia still remains problematic. You can see Malaysia's numbers are still really incredibly high, at above 600 cases per million per day. Thailand's number looks like it's finally peaking, so that's good news. They have struggled with this wave of Delta. Prior to this, they've really done well. In fact, they've been lauded for their response to COVID. Numbers have been very low, but this recent against Delta, they've really struggled. Philippines, you're seeing another surge there. Indonesia numbers, like I mentioned before, they surged a bit and they're going down. So that's good news because Indonesia was getting hit really hard. Laos and Cambodia, Vietnam, again, they're all plateaued at a fairly high level. So that's really a concern. Japan is still surging. Is this the remnants of the Olympics? Probably. But Japan's numbers are really looking bad right now. And you can see that line is just going straight up. I will go on record as saying that the Olympics were a horrible idea. It was a horrible idea. It really was. Especially in a country that had such low vaccination rates with Delta surging. And this is the result right now within Japan. South Korea numbers have actually plateaued. They're kind of in a weird plateau right now. They're trying to vaccinate as quickly as possible, but they're struggling as well. Taiwan, after a blip, they've really responded. They locked down hard. I have a good friend in Taiwan, and he informs me that he has not seen an unmasked face outside in years now. And so the Taiwanese have been able to really, and their vaccination rates have improved, so they're starting to vaccinate. But the Taiwanese have really clamped down, and you can see the results. China's numbers I don't trust at all. I think they are having problems with Delta. Last I checked, Wuhan was being shut down again because of surges in Delta. So I'm not really trusting those numbers. Mentioned Australia. A single case in Sydney that got through their quarantine is causing the surge. Again, it's not huge because you're talking about 20 per million per day, but for Australia, it is significant. You can see that number going straight up. So that's the problem with Delta. Remember, you are infecting twice as many people. So one person can infect 4 or 5, which then goes on to 25, 125. You can do the math. So you're talking about exponential. I mean, you're talking about double or to triple the number of new infections per generation. And so you have graphs going straight up like this. And that's what they're struggling with right now. New Zealand has seen a recent small surge because of a traveler from Sydney going to New Zealand, and again, getting past their travel restrictions. The prime minister there ordered a snap shutdown for 3 days, but I believe they've extended that because they're having troubles controlling that now. That's a problem with not vaccinating and relying solely on restrictions. With Delta, it just kind of changed everything. It's so transmissible that you really have to use vaccination to really do any controls. The margin of error with Delta is so much smaller than with the original wild type SARS-CoV-2. One little slip up and you have what's going on in Australia right now. That is a busy graph, I know. This is Europe. You can see that the UK, and I'll talk about the UK in a little bit. UK is now going up again after that steep decline, and it's going up slower though. All eyes are on the UK because they have high vaccine rates. They have really good data infrastructure. They have really amazing data. Some of the most trustworthy data on COVID is coming out of the UK. I would actually say it's much significantly better than the US. The problem with US data infrastructure, of course, is that it's a combination of 50 different data infrastructures, and those 50 vary quite a bit. I'll get to that in a second. But you can see that there are some countries, Switzerland, I mentioned Central Europe, excuse me. Yeah, it's kind of Central Europe. Switzerland is starting to surge. You're seeing Germany and Sweden start to surge. Netherlands went down, but is now plateaued. Same with Spain. So we'll have to see what's going on. There's some interesting trends in Europe right now, but Delta is still hitting Europe hard. We have not seen the end of Delta yet in Europe. But like I said, I'm really keeping an eye on the UK numbers. I mentioned Eastern Europe is now surging, so it was inevitable. Kosovo, Montenegro, you're looking at, they're starting to approach their previous peaks. Lithuania, Serbia, surging, Bulgaria surging, Slovenia, Croatia. Greece is kind of plateaued at a high level. Russia, again, I'm not really confident in reported Russian numbers, given the autocratic nature of that government. So I'm not quite sure. I think it's much higher than this, quite honestly. So let's talk about the UK a bit. So we saw the surge caused by Delta. And then there was Freedom Day, of course, where Prime Minister Boris Johnson announced that all restrictions are removed. And then the numbers started to go down, which was really shocking to, I think, many of us in public health. Excuse me 1 second. Just checking the comments. Okay. Nope. Give me 1 second here. All right, just checking the comments on Facebook. So we were all kind of confused by this because the economy opened up, but we saw a sharp decline after a steep rise. What we now think happened with that decline is actually not is not because of Delta waning, but because of changes in behavior. Number one, Eurocup was a much bigger super spreading event than we thought. That's probably what caused a lot of this decline. As soon as Eurocup was over, and of course, England was in was doing really well in the Euro Cup. So a lot of folks, particularly young soccer fans, got together in pubs, got to the stadiums. It was essentially a super spreader event. Scotland had the same thing. Remember, Scotland and England had separate teams. However, Scotland got knocked out earlier, and their surge started to end earlier, okay, than England. And so that probably explains part of this decline is when Euro Cup was over, people stopped having super spread events. And so you saw a decline. This increase is probably the result of the Freedom Day, so-called Freedom Day, as people start to move around again. So this kind of tells you how significant these super spreader events can be. Along with schools, and it was also when it was declining, schools were on holiday. It was like hot in the UK. So these are what's probably caused those decline. Now we're seeing the effects of the so-called Freedom Day. We're seeing slight increases again, but not as steep. And I think maybe the other dynamic here, of course, is that the UK has extremely high levels of vaccination. And so this is why we're paying attention to what's going on in the UK, because this can be a hint to what we can expect in the US. Now, the warning here is that the UK has much higher vaccination rates than the US, especially regions of the US like the South, which has, quite honestly, abysmal vaccination rates. So we'll see what happens here. Right now, you're seeing a slight increase. So really pay attention to the UK numbers in the next 2, 3, 4 weeks, because it can give us an indication what to expect here in the US. The good news is, though, hospitalizations remain low. So the vaccines, again, vaccines may not be as effective against infection. Remember, all of the efficacy data from the clinical trials looked at symptomatic disease. The clinical trials told the participants, get tested if you're showing signs and symptoms of COVID. So they had no idea, those efficacy numbers weren't against infection. How many of those clinical trial participants had asymptomatic disease? We have no idea. It was against symptomatic disease, hospitalizations, and deaths. So we suspect that efficacy against infection is much lower, maybe significantly lower than we thought. But which actually, we got to discuss that, because symptomatic people, asymptomatic infections can still shed virus. Although all the data I've seen shows that vaccinated folks, that it even decreases the risk of transmission. The period when they're shedding virus is much shorter, and they don't seem to shed as much virus. So, but they still can transmit. Okay, so that's, again, this is why I say we have to differentiate, be conscious about differentiating disease from infection. But the good news is all data shows that the vaccines are still incredibly effective against disease, against hospitalization, against death. And this is an indication. So you can see in the previous slide, you had a peak that almost matched the previous peak during the winter. But hospitalizations were nowhere near that. So you have to question whether maybe we should just stop talking about efficacy against infection. Okay, some folks measure the effectiveness of a vaccine against infection, whereas really a lot of us think, no, the point of a vaccine is to keep people out of the hospital, keep people from suffering symptoms, keep people from dying. And by that metric, these vaccines are still incredibly effective, even against Delta. All right, so let's talk about vaccination globally. We're about 500 million. This is confirmed deaths per million people. Sorry, I'm not quite sure what that. Okay, I got the wrong slide. Sorry. Let's go. So these are daily new confirmed deaths. I apologize. I'm sorry. This is deaths. Yeah, I'm sorry. We're not to vaccination. I apologize. So deaths. So we're about 500 million. No, deaths per million. So 500 deaths per million. Close to 550. And daily deaths, about 10,000 deaths a day right now. not as bad as it was, but not great. And you can see it's a kind of plateaued a little bit. So that's good news. As far as deaths are concerned, you can see Indonesia. This is the results of that surge. These are the deaths due to that surge. And Indonesia is really struggling. If you've never been to Indonesia, it's very densely populated, but at the same time, there's a lot of outlying islands, and their healthcare system really struggles to kind of reach everybody because there's so many small islands in that country. It's very densely populated. Of course, poverty levels are high, so you're getting some significant number of deaths there. Asia has, it looks like deaths have peaked a bit and maybe start going down. That's again as a result of the Indonesian surge. North America, however, is going up. South America numbers are going down, so that's really good news. It's now lower than North America. These are counts. These aren't per capita numbers. These are counts. Africa's kind of plateaued. Just count on African numbers to be significant underestimates. We won't really know until we look at excess mortality data exactly how much death is occurring in Africa. And then, of course, Oceania, those death numbers aren't looking too bad because, again, New Zealand and Australia are, of course, very wealthy countries. They have very robust hospital systems. So you can see Indonesia is at about 1,200 deaths per day. Probably, again, count on it being much higher than that. I would say by magnitude of 5 to 10. Brazil numbers are much better, but they're still second. US is third now in deaths per day in terms of counts. Russia is fourth. This is why I think Russia case numbers are probably significantly lower than reported. It's significantly higher than reported, excuse me. Mexico is fifth, Iran sixth, so you can see the numbers here. From a per capita standpoint, really you can see the areas that have the highest per capita. North America now is almost number one in terms of per capita deaths. South America is doing much better there. But you can see that by next week, my guess is by next week, we will exceed South America in terms of deaths per million. It's not a great place to be at all. Europe is also rising. Asia's kind of plateaued, starting to go down. Africa, again, underestimates. But you can see even Australia, New Zealand, struggling. Most of the deaths, however, in Oceania are in Papua New Guinea and Timor, not necessarily Australia and New Zealand. So you can see by deaths per million, you can see that Fiji, again, small Pacific island, small South Pacific nation, Tunisia, Georgia is really struggling. A lot of African countries in this list, unfortunately. But you can see also some Eastern European countries sneaking in here. You get Montenegro and let's see, North Macedonia. You see South Africa, Botswana. So African countries are represented here. Malaysia is really, again, really struggling. Not only a surge in cases, but a surge in death as well. Eswatini, a small country in bordering on South Africa. Vietnam, which has been doing extremely well to date, kind of similar to Thailand, but have struggled against Delta because, you know, again, with Delta, everything is just less effective because of how transmissible it is. That's what happens when you have a disease that has double the R naught. The margin of error is much, much, much smaller. Social distancing is really kind of almost irrelevant because it's so airborne. Masks still are effective, but not as effective. Restrictions and quarantines are not quite as effective. Your margin of error is much lower. So these countries that have been doing extremely well using those traditional public health tools, they're not doing as well with Delta. And again, one slip up with Delta and you can have an explosion of cases. And pretty soon it's completely out of your control. I mean, with Delta, contact tracing with Delta becomes much harder because you got to trace so many more people and then contact them. And so it's really, this is the burden that Delta places on a public health infrastructure. You may need literally twice as many contact tracers to do effective contact tracing. These are the changes in deaths. You can see Canada and the US kind of lead the way. Saudi Arabia, Europe, Japan, South Korea, Australia, really struggling. Sweden struggling again. We haven't heard from Sweden in a while. But yeah, they're seeing a little bit of a surge as well. And you can see Eastern European countries are well represented. You're seeing this surge in Eastern Europe. Czech Republic, Kosovo, Montenegro, Albania. You see the Dominican Republic here. So a lot of African countries are seeing surges in death because of Delta. As far as dose, here's the vaccine doses. We're almost at 5 billion doses, which equates to a blank slide. Sorry. Which equates to about 2.5 million people vaccinated. Still have a long ways to go, but that's progress, I guess. And quite honestly, it's quite extraordinary that we've been vaccinated only for about 8 months right now, and we've vaccinated 2.5 billion people. That is extraordinary. It really is. It's unprecedented in history. It really is. But we still have a long ways to go. These are the countries that have the highest levels of vaccination. You can see UAE leads the way with 84% of their entire population with at least one dose. So that's their entire population. So that's excellent. Iceland is second. Qatar, Portugal, Singapore, Uruguay. So you can see there's many, many, many countries now above 70%. You can see Canada. Let's see. Canada is up there. Chile is up there. Ireland, Bhutan, which is great because they are again, Bhutan has been lauded for their public health infrastructure. What the country you don't see in this list, and this is the top 25, of course, is the US. We are now no longer in the top 25. I don't know if we're in the top 30, quite honestly. So yeah, we have really fallen behind on our vaccination. You can see how these other countries are doing much better in terms of vaccinations. Now, with COVID, with Delta, of course, like I said, everything is slightly less effective, including vaccination. So even countries with high levels of vaccination, for example, Israel is at 68% with at least one dose, 62% with fully vaccinated. They're still seeing a surge. Remember, Delta is a lot more transmissible. So it takes a lot fewer number of potential hosts to really spread rapidly. So you think, 60, 65% is really high, but that means 32% are still unvaccinated. And given how transmissible Delta is, it spreads in that population extremely rapidly. So that point where you can easily control transmission through vaccination becomes much higher. So you may have been able to get away with vaccinating 70, 80% of the population with a less transmissible strain. With a more transmissible strain, you may have to bump up that to 90% to effectively control transmission of that disease. Okay, and remember, the more disease that is circulating through the unvaccinated, the more likely breakthroughs are going to happen. And there's going to be more breakthroughs, infections, the more people are vaccinated. And that is counterintuitive, and that confuses a lot of people and actually sends the wrong message. But remember, yeah, that's going to happen. That makes sense. In fact, I would argue that entire Barnstable County study, the one from Provincetown in Massachusetts, that dictated our mask response, was really overinterpreted. It just focused on how many breakthrough infections there were. Basic epi, you can't just look at counts in that case. What was the denominator? In that population, the vast majority of them were vaccinated. Of course, you're going to get way more breakthrough infections than non-breakthrough infections because there was way more people who were vaccinated. So just trying to hammer it in some points so that it's not misinterpreted. This, of course, is the other side. The DRC has less than 0.1% of their population vaccinated. Not 1%, 0.1%. And I'm going to address this because we're going to talk about the boosters in a bit. But you can see almost all of these countries are in sub-Saharan Africa, along with Haiti, Yemen, a few other countries, but the poorest of the poor countries here. These are the countries where not even frontline workers who are exposed to COVID every day are vaccinated. So yeah, that's what's happening in the world. Mixed bag. Some areas are struggling still. Other areas are doing much better. South America is doing much better. North America is surging hard. Europe, things are shifting and it's hitting Eastern Europe. Asia, there are regions that are being hit hard, regions that are improving. Africa, it's just really unclear what's going on in Africa because of lack of data. So yeah, the whack-a-mole continues. The US, we're surging. We are the reason why North America is probably the continent that's maybe doing the worst. Pretty soon it's probably going to be doing the worst. We are the #1 country in terms of cases per day. Will we hit, I mean, if you look at these numbers, we are starting to match the previous surge over this winter, which is not unexpected. So by region, Mississippi is getting picked on. It's really the South that's driving it, but the entire country is surging. It's just the level of surge differs by region. So you can see that the Northeast has a surge, but not nearly as bad as the South, with the West and the Midwest kind of in the middle. But you can see, I mean, the South is really, really surging. You can see that that level. Mississippi right now is getting picked on because they have the worst numbers right now. And you can see, yeah, pretty obvious. Yeah, I mean, Mississippi, Alabama, not doing quite as bad as Mississippi. Louisiana continues to struggle. Florida, see Georgia and South Carolina numbers going up. Kentucky numbers going up. Arkansas and Missouri are slightly better, but remember they surged really early. Arkansas numbers are still bad. Missouri's a little bit better. Southern Indiana, Southern Illinois, and Southern Indiana starting to be affected. Texas has some really bad numbers. Oklahoma has some bad numbers. And the Northeast, though, is doing okay still. They are still seeing an increase, but not nearly to the magnitude that you're seeing in the South. Same with the upper Midwest. The West Coast, it kind of varies, and you got to be careful with the West because it's such a broad expanse. So in Oregon, for example, there are areas, typically rural areas, typically with lower vaccination rate, that are struggling. Same with Washington, Idaho, Wyoming is really, really high right now too. So yeah, see by state, Florida, in terms of cases per day, Florida leads the way with 23, almost 24,000 cases per day. Then Texas is now second, 16,000 a day, both rising. California is rising, but not as much. Georgia, North Carolina, Louisiana. So you can see a lot of southern states here. I like to look at per capita numbers, and this is more telling. So you can see Mississippi's #1, 120 cases per 100,000 per day. Then Louisiana, oh, actually 7-day. This is 7-day, excuse me. Not that bad, daily. Sorry, 7-day running averages, daily cases. So 120 per 100,000. That's really not good. In Mississippi, Louisiana, Florida, Arkansas still struggling. Alabama's up there, Kentucky, Georgia, South Carolina. Again, all southern states, all with extremely low vaccination rates, with the exception of possibly Florida, which at 51%. And even in Florida, you can kind of break it down by county, and you notice that the counties with the lowest vaccination rates are the ones that are really surging. Georgia, okay, so again, all southern state with the exception of Alaska, Texas, Oklahoma, and Wyoming's there. Hawaii is surging because I think Hawaii, because they have a lot of tourism, I think they've struggled with numbers as well. Yeah, Utah's up there, not quite as high as it was earlier. Utah's going up, but our numbers aren't going up as steeply as some of these other states. So that's good news. so far. These are the states with the lowest numbers. So you can see Maine, Michigan, Maryland, Connecticut, New Hampshire, Vermont, Pennsylvania, Massachusetts, New Jersey. So a lot of northeastern states as well as upper Midwest are doing quite well so far. Now, will we see a surge? Is this part of seasonality? Possibly. It's hard to sort that out because the regions, I mean, vaccination rates vary by region. So the Northeast as a whole has very high vaccination rates. The South has very low vaccination rates. So is it seasonality or vaccines? It's really hard to sort out. Will we see a surge in the Northeast too? It's hard to say. The Northeast actually has vaccination rates equivalent to the UK, for example, which has very good vaccination rates. The South has not so much. So it's really hard to sort out whether it's seasonality or vaccinations right now. Yeah. But yeah, you can see mostly Northeast. The one exception was North and South Dakota, and South Dakota is starting to move up really rapidly in the other direction, probably because they decided to still have Sturgis. Remember Sturgis? Well, they just had it again during a Delta surge. So, because, you know, South Carolina, fortunately, their governor isn't quite as, you know, she doesn't really take COVID seriously, and that's kind of an understatement. So expect a surge in South Dakota coming soon. Because when you have millions of bikers in one little town, you're going to spread COVID, especially Delta. And unfortunately, this demographic is less likely to wear masks, to be vaccinated, to socially distance. So as far as changes, you can see South Dakota. Yeah, again, why South Dakota is surging? Probably because of Delta. Probably because of Delta and Sturgis. Okay, South Dakota, West Dakota, North Dakota, they're all going up. Just about every state in the country is seeing increases. Again, lower increases in more vaccinated states, higher increases in non-vaccinated states in general. Hospitalizations, Florida, that's 16,000 hospitalized daily. There's no hospital system that can sustain that, and they are struggling. That's 77 per 100,000, by the way. So if you look at per capita, you can see Florida by far the highest, then Louisiana, Alabama, Mississippi, Arkansas, Georgia. Again, these are going to be even more dominated by states with low vaccination rates because vaccinations protect against hospitalizations. It's not doing that. And these are states with very low vaccination rates, right? You got Louisiana, Alabama, 36%, 39% Arkansas, 40%, 46%. So yeah, you're gonna see high levels of hospitalization. As far as deaths, same thing with deaths, dominated by states with low vaccination rates. Because again, vaccines are highly effective against deaths from COVID. And these states have extremely low death rate, extremely high, low vaccination rates. The exception here is California. California is seeing a little bit higher mortality rates, or at least deaths per day. But if you look at deaths per capita, I apologize, if you look at deaths per capita, actually California drops down off the list. So take that back. You can see Florida is a little bit of an exception, but yeah, again, if you look at per capita, per 100,000 deaths, dominated by that states with very, very low levels of vaccination. Yeah. So that's where you are with deaths. So again, I'm not thinking that this latest surge, especially at least in the US and other more wealthy nations with access to vaccinations, I don't think hospitalizations and deaths will meet the peaks that we saw earlier before the vaccinations. That said, in states with low levels of vaccinations, we're still going to see surges in deaths and hospitalizations because of lack of vaccinations. Luckily, if you look at the over 65 population, the levels of vaccination are much higher. So they shouldn't see a surge in deaths. However, as long as there's virus circulating in the population, we're going to get more breakthrough, especially in the senior population. Over 65 population, there will be more breakthrough cases, not because of efficacy that the vaccines aren't effective, but because older immune systems aren't as robust. So yeah, breakthrough infections in those over 65 are going to be more serious. More of them are going to lead to hospitalization. More of them are going to lead to death, especially in states that have high levels of virus circulating and high levels of people who are unvaccinated. So those unvaccinated 19, 20-year-olds are a threat to their vaccinated grandmothers and grandfathers. Yeah. So yeah, we are going to see breakthrough infections, especially among seniors, especially in places like Florida, Alabama, Louisiana, leading to breakthrough deaths and breakthrough hospitalizations, breakthrough deaths. Okay. As far as vaccinations, slightly better news. We have increased the rates. We're now at 51.1% fully vaccinated in the country. Which, when you look at that other list, we're about 30% behind the top countries. Some countries are over 80%, which means they've vaccinated just about every adult in the country, and they're just waiting for the vaccines to be approved for kids. We are way behind there. That's the bad news. Okay. Good news is at least over 65 and up, 81% fully vaccinated, 91% at least one dose. So that's good news. It looks a little bit better here if you look at the 12 and up. 70%, 60%, not bad. And the other piece of slightly good news is that the rate of vaccinations increased slightly. So we're averaging over 800,000 doses a day, which is better than the 500,000 we were at just a few weeks ago. So it seems like Delta has encouraged more people to get vaccinated, slightly more people. I'd like to see that increase a little bit more. Some of this may be due to vaccine mandates that have been being implemented, particularly in colleges, the military, a lot of private companies, the state of New York, the state of California, federal employees. So those vaccine mandates will probably make an improvement in these numbers as well. We'll see. I think that's probably the direction we're going to have to go. Is in the absence of a federal vaccine mandate, we're just going to have to piecemeal it. Individual schools, private companies, the more progressive states are going to have to mandate vaccinations, and that hopefully will kind of up the levels. Yeah. So this hasn't changed much. You can see vaccination levels are really low in those states that are being hit really, really hard right now. It's that the states that aren't hit so hard, pretty high vaccine rates. So it's pretty obvious. What I find interesting is that the areas around the border in Texas are much better vaccinated than the interior. So it seems like outreach towards the Hispanic community is probably been very, very positive, and it's because those areas have very much higher rates of vaccination. And so Ted Cruz spouting off that, hey, it is undocumented workers that are spreading COVID is a load of BS, because that's what Ted Cruz is generally full of. Okay, I'll try not to be as political. I know this is a public post, but it's been frustrating dealing with folks like that spreading misinformation. Okay, so by state, again, wide variations. I ranked this by over 18. Hawaii is doing extraordinarily well, 87%, at least one dose over the age of 18. Meanwhile, Wyoming's at 54%. So, you got an over 30-point difference between the best vaccinated state and the worst vaccinated states. So you can see the bottom here, Wyoming, Mississippi, West Virginia, Idaho. Not coincidentally, the states seeing the surge. Yeah. You see, if you rank this by, over the age of 18, Utah actually isn't that terrible. We're kind of middle of the pack, maybe a little bit better than the middle of the pack. We're just behind Florida, which is, never thought I would say that, but that's a good thing. I don't know. Anyways, yeah, in fact, we have higher levels of vaccination than even, Wisconsin, Nevada. I guess that's a good thing. It's hard to say. Anyways, yeah, so we're not doing so terrible, but that's the thing. That's, Vermont, 86%, Massachusetts, 86%, Connecticut. Again, these are the states that they're seeing surges, but not nearly as significant as the other states in the South. So just a few states, Florida. It's pretty bright red, yeah. And you can see they have far exceeded their previous surge. They may be on their way to doubling their previous surge. Now with Florida numbers, you can see you're probably seeing all these lines here. Florida has decided to report numbers to the CDC once a week. And that is a problem. That is a serious, serious problem. And this is why I say I have much more faith in the UK numbers, which has a very robust nationalized data infrastructure, to the US, where we have 50 fragmented data infrastructures, and each state can decide what they want to do. Florida decided they're going to report once a week. It's hard to really react to data when it's only once a week. In fact, I don't know why their calculations, see this line is 7-day average, but you can see how much lower it is than the individual lines. They need to recalculate this. New York Times actually has to recalculate this. That 7-day average should just be literally what they are reporting every week. It should be much higher. So by that measure, they have already doubled their previous peak. Yeah, so it's kind of screwy. It's really frustrating. Several states are doing that. I find it actually frustrating that Utah only reports Monday through Friday, and weekend numbers are reported on Monday. But that's not nearly as frustrating as reporting it once a week. Again, this is because, you have a governor that's basically, his entire political stance is that COVID's not a big deal. And he's going to do everything to make it not a big deal, which is reporting it once a week. And several states are doing that, and that is incredibly frustrating. Arkansas, they're doing slightly better, but again, they've matched their previous peak. Louisiana has exceeded their previous peak. Again, they're not reporting as frequently as they should. They have probably also doubled their previous peak. Alabama is starting to surge hard too, especially the southern part of Alabama. Mississippi is surging hard. Again, they have matched their previous peak, probably on their way to exceeding it. Texas is on their way to meeting their previous peak. You've all probably heard Governor Abbott has been diagnosed with COVID. He is vaccinated. It is a breakthrough infection. And a lot of localities in Texas are fighting the governor and the state government over mask mandates. Meanwhile, Massachusetts doing they're seeing an increase, no doubt about it, but not nearly the magnitude that we're seeing in the South. Same with Minnesota. That's not even close in Minnesota. So could this be seasonality, or could this be vaccination rates? It's hard to say. It's hard to tease that out, because we definitely know there's seasonal patterns with COVID, with SARS-CoV-2, that we're still trying to figure out, because we're only in year 2 of this thing. Oh my God, it feels like freaking 20 years. We're not going to say aged in dog years anymore. We're going to say aged in COVID years. Anyways, Pennsylvania too. Yeah, they're seeing a surge, not nearly to the degree that you're seeing in the South. Now, will we see more significant surge? Is it seasonal? Maybe fall time is where we're going to see a surge in the Northeast. It's hard to say. It really is. And that's why it's worth keeping an eye out. I'm not going to sit back and say, oh yeah, those states are going to do much better because they have high vaccination rates, because you're seeing what's happening in places like Iceland, places like the UK, places like Israel that do have really high vaccination rates, equivalent to that of these northeastern states. And they're seeing horrific surges. So I'm not confident at all in what's going to happen in the next few months. I really don't know. I think a lot of epidemiologists are frustrated too, because Delta has just completely changed the outlook. And this is South Dakota. Surge in South Dakota. Yeah, you're starting to see a surge. Doesn't seem big, but again, what my concern is Sturgis. They are also reporting once a week. So you can see, yeah, once a week. Yeah. It's really incredibly frustrating. Oh, excuse me, there's a chat. Texas Supreme Court ruled that school mask mandates will be allowed. That's good news. That's really good news. See what the governor does. We'll see. Yeah, it's kind of interesting. This is a party that is all about local control. Well, obviously not. All right, let's talk about Utah numbers. So just to summarize national numbers, the South, bad. Northeast, not as bad. The West, not quite as bad, but bad. Just different degrees of bad. It's good a summary as any. Good news is, though, hospitalizations and deaths are not quite as high as before, but they're still high, especially in the states with low levels of vaccination. ICUs are getting hammered in the South. And healthcare workers are just probably this much closer to burnout. I know I am. And I'm not a healthcare worker. All right, let's talk about Utah. Utah is also experiencing an increase because of Delta, but not as steep as some of these other states. Even, Wyoming's actually doing quite poorly right now. But we're seeing increases, but, and it seems bad. We're over, 1,500 again, but not as bad as some of these other states. You can see by county, Salt Lake, of course, is number one, but a 14-day change of 7% is not terrible. Utah County, 9% increase. Davis County, 6%. Weber County, a little bit more, 15%. Wow, Tooele County had more than 100% increase in the last 2 weeks. But really, if you look at the Wasatch Front, it's not doing terrible. We're seeing increases, but not significant increases. By per capita numbers, Daggett County has seen a bit of a surge. Tooele, like I mentioned before, is high. St. Pete, Emory, Iron, Paiute, Washington, that's the first really densely populated county here. If you look at Utah, at the Wasatch Front, Weber County is number one, then Utah County. But you can see Salt Lake County is kind of middle of the pack, so it's not doing terribly. And then, of course, Davis County is actually doing even better. In terms of increases, you're seeing a lot of increases in rural areas, but not so much in the Wasatch Front. So that's the good news. Wasatch Front seems to be doing better in terms of COVID than some of the more outlying rural areas. Hospitalization, there's a lot more hospitalizations throughout the state now. Again, we always say hospitalizations will be lower because the most at risk are immunized, but we're still going to see an increase in hospitalizations. And again, we are awfully close to capacity, if not over capacity, in many hospitals. And what's sad is the pediatric units are getting filled up. The big concern right now with pediatric units is the combination of COVID and RSV. RSV is not supposed to peak until November, December. Never seen a peak in August. That's really kind of frightening. So you can see the changes in hospitalization. The rural areas are really seeing significant changes in hospitalizations. Utah County, among the Wasatch Front, is seeing the most significant increases in hospitalization. Utah County, not coincidentally, by the way, has the lowest levels of vaccination, at least among the highly populated Wasatch Front counties. And deaths, you can see Salt Lake is doing okay. It's the underlying, it's the rural counties that are doing doing the worst in terms of deaths. Probably again, largely linked to lack of vaccinations. So here's our rolling test positivity. The good news here is that testing frequency has increased, probably largely driven by increased testing due to school starting. So a lot of required testing for schools. So that's good news. We do need to do more testing. I'd like to see more testing of vaccinated folks as well, just to kind of get a handle of breakthrough infections, not just breakthrough cases or breakthrough disease. So we're hovering around 10% test positivity, which isn't great. We were down pretty low, but it looks like it's kind of plateauing right around 10%. Like I mentioned, hospitalizations have increased significantly, and deaths have increased as well. Will they be as high as our previous peaks over the winter? Hopefully not, because again, the ones that are most risk for hospitalization and death are highly vaccinated, but we will still see an increase. And hospitalization patterns have changed. You're having fewer folks over 65, more younger people because of Delta. And it is all Delta. You can see that just about every sequence, all the sequencing that we do, it's all Delta. And that, again, it makes sense. A strain that is spreading to twice as many people per generation is going to dominate every other strain. And that's what's happening right now. It is all Delta right now. In terms of vaccinations, this is 2 weeks old because I didn't have probably last week. Made some progress. We're at, fully vaccinated over 12, about 60% almost. It's progress. But, again, daily vaccination, we're seeing an upward trend, but not very steep. So, maybe 10,000 doses a day, which isn't great when you consider we were doing 40,000 doses a day at our peak. And we still have a long ways to go. So vaccine hesitancy is still an issue. And again, Juab County is not, or Sanpia County or Piu County, I'm just looking at those numbers. They haven't changed much at all. They're still stuck in they haven't exceeded 30%. Meanwhile, Summit County is at 70%. So wide variation by county. Grand County, Salt Lake County, 52. Davis County, 49. Not coincidentally, those are the two counties in the Wasatch Front that are doing the best in terms of cases, hospitalizations, and deaths. Utah County is doing the worst, and they have the lowest vaccination rate in the Wasatch Front. Overall, by age, you can see that 12 to 15. The promising thing here is that there's a 15% difference between fully vaccinated and receiving one dose. So that to me indicates that people are starting to get their kids vaccinated, maybe in response to going to school. Hopefully those 15% that receive one dose will be fully vaccinated. So that is good news, at least. And in fact, that age group is probably being vaccinated at the highest rate. And I'll show you that data in a second. Over 16 to 70% one dose. The good news here is 91% over 65 have at least one dose. So that's really good news. So you can see that the 12 to 18 group, that slope is much steeper. So they're getting vaccinated at the highest rate. However, the 19 to 29 and the 30 to 39, those levels have been stagnant for weeks now, for months, really. We got to get those folks vaccinated. They are not getting vaccinated for various reasons. This is awesome. Now, I just want to plug the Utah Department of Health's data interface for COVID. It's phenomenal. Is it perfect? No, but it's really, really good. And how do I know it's good? Because I've actually been on several other states' interfaces. And this is my frustration, that I wish there was a standardized interface for each state. There isn't. I pretty much have to get to the raw data to do state-by-state comparisons because their interfaces vary so much. Some states use 7 days. Some states use 14 days. It's a mess. It's an absolute mess. And it makes Epi really hard when you don't have consistent data. It's just one more thing that we have to deal with. Whereas the UK, one system. So anyways, but that said, rant over. Utah's is probably one of the best. I've looked at every other states, even states like Massachusetts, California, which I expected to have really good ones. They're not as good as this one. It's really, really good. Like, for example, finding breakthrough infections, so much easier with Utah. With other states, a lot of states aren't reporting it at all, which is ridiculous. Don't get me started with Texas's system. I don't know who, some 12-year-old set that thing up. It's garbage. Can't find anything on it. And, you know, that might be part of the plan, you know. Again, in states where they're trying to minimize COVID, yeah, make it harder to find the data. Sorry, Chris, but yeah, Texas is hot garbage, hot garbage. Okay. Anyways, Utah's is good. So this is new. This is under in the coronavirus.utah.edu under counts, and this is under trends, not trends. No, trends. Risk factors. This is under risk factors. So what they started to do is kind of calculate relative risk. Very simple. So relative risk is just a measure of risk. Those who are the incidence rate of those exposed over those non-exposed. So in this case, it's the incidence rate of COVID among those unvaccinated over those who are vaccinated. It tells you how many more times those who are unvaccinated are likely to catch COVID or to be hospitalized or to die from COVID than those who are vaccinated. So you can see more than 5 times more at risk for testing positive if you are unvaccinated than if you're vaccinated. Almost 6 times more likely to be hospitalized, and almost 8 times more likely to die of COVID than those who are unvaccinated. So that's a really good way to communicate risk to the general population. Right. So I think that's really good. So basically it says, here's the incidence rate among vaccinated. So this is for cases and unvaccinated. So it's basically, oh, how many more times are the unvaccinated more likely to get the disease than the vaccinated? So it's just this incidence rate divided by this incidence rate. Pretty simple. But again, a really easy way to communicate risk. Now, one thing I want to comment on this is I believe this was Washington Post, did this for every other state. And Utah had some of what's a little concerning, they had some of the lowest relative risks. Rhode Island and Utah. There were states where the unvaccinated were 10, 15, 20 times more likely than the vaccinated. I think it's because, again, varying quality of data. Some states are not doing a very good job of counting breakthrough cases. I think Utah is doing a much better job of it. It's hard to say. I'm still trying to figure that out, why Utah has some of the lowest. And you can see the rate ratio by age. For younger people, the risks are even higher among the unvaccinated. For older folks, it's less. Okay. It's only 3 times more likely. So something to consider. And this kind of reinforces that if you're older and there's lots of Delta circulating, it increases your risk, even if you're vaccinated. And here's the counts here. So you can see, yeah, breakthroughs are going to happen. And then here are the trends here. So you can see that here is the green is the incidence rate for fully vaccinated, and this orange is the incidence rate among unvaccinated. And this is hospitalization by vaccinated and unvaccinated. So really good data, really nice interface. You can just immediately eyeball, okay, let's look at the rates of breakthrough infections compared to non-breakthrough infections. Have not found a really clean interface in any other state. So Utah numbers are increasing, but not, and it's concerning. I mean, we're breaking 1,500. Quite honestly, I haven't even looked at today's 1,100, including 216 new cases in school children. Now, I'm thinking that we're going to see increases, maybe some steep increases in the next few days now that school has started. We'll see. That's the other thing that is just really hard to predict is school starts. How is that going to affect COVID rates? Yeah. Anyways. All right. Oh, shoot, I'm running out of time again. I always do this. All right. Let's talk a little bit about the booster. There's a lot of controversy around this in public health circles. Now, there's two aspects of two target populations of the booster. One is to immunocompromised folks, so people with organ transplants going through chemotherapy, are on immunosuppressants, HIV positive. Studies have shown that their immune response is not nearly as strong after administering the vaccine. Makes sense. Their immune system is suppressed. They're not going to respond as well to the vaccine. Now, the big breakthrough with these vaccines is that we can actually immunize the immunocompromised. Especially with live attenuated vaccines, you cannot vaccinate immunocompromised folks because these are live viruses that could actually make people sick if their immune systems are compromised. So the mRNA vaccines and the viral vector vaccines are great because they can be administered to the immunocompromised without risk. In fact, the risk is the opposite, that there isn't enough of an immune response. And that's what the data has shown, that if you are immunocompromised, you don't have the immune response. So we've been kind of experimenting with possibly giving a third dose, that booster, to see if it actually boosts immune response. So with the third booster shot for those who are immunocompromised, there's really no controversy there. It just makes sense. In fact, a lot of us think that might not be enough. You might have to get a series of boosters. A third might not be enough. We might need more to get more of an immune response. So there's not real controversy about that. It makes sense. With seniors, you can argue the same thing. Seniors have less robust immune systems, although the data has shown the initial efficacy data for Pfizer and Moderna especially shows that there's really no difference in efficacy by age. The efficacy for seniors was just as high as the efficacy for 20-somethings. But for seniors who are at higher risk for disease, for hospitalization, death, it may make sense. For everyone else, that's where the controversy is. Now, there's two levels of controversy. Number one is the scientific, number two is the moral. And I'm going to throw in a practical as well. The moral argument, of course, is that, and this is the WHO stance, and the WHO is furious with the US and more advanced countries. And that is, and by the way, this is going to be tied into the practical aspect, and I'll get to that in a second. That is that there are countries around the world where, and you saw the numbers, less than 0.1% of their population is vaccinated. And we're talking about boosters to people who are already vaccinated. Yeah, that's a huge moral problem. I mean, and this is also linked to the scientific as well. We'll get to that in a second. So that's probably the big issue that the WHO and a lot of people around the world have. It is that sense of justice. And from quite honestly, I also have this problem. Should we use precious vaccines to increase efficacy in Americans who already are protected by, small, maybe a small amount, maybe a few percentage points? Whereas that one dose to someone who's unvaccinated can make significant difference. Scientifically, epidemiologically, if we can divert that dose to someone who is unvaccinated, that's going to do far more to slow down and stop this pandemic than it is to increase the efficacy of the vaccines just slightly in a person who's already protected. Yeah, that's a problem I have too. Okay, so there's the moral and ethical problem that is linked to the scientific problem. So let's go into the scientific problem. So number one, we don't know how much this will boost immunity. We have no idea. Most of these studies that say the booster shot improves immunity are immunogenicity studies, meaning that it was done in a lab. They got some blood from someone with the third dose, looked at the number of antibodies. Oh, there's more antibodies in a person with the third dose. Again, I want to emphasize that we don't know what level of antibody constitutes protection. We have no idea. We don't have any sort of good metric for that. Number one, we don't know how many antibodies are protected. Number two, it doesn't actually take into account other parts of the immune system, killer T cells, memory cells, all the other parts of the immune system that help protect against disease. It just looks at one aspect. So we have no idea if, oh yeah, great, tenfold increase in antibodies after a booster. Will that improve? How much will that improve immunity? We have no idea. There's not very, very little human data on this. We probably won't get human data for a while until those people with the third dose are out there and we can gather data. So that's problem number one. Problem number two is, I mentioned before, epidemiologically, it doesn't make sense to use precious third doses to improve efficacy in people who are already protected versus someone who has no protection. That's an obvious one. Okay, so third, these studies that show the waning of vaccines, they're unclear. They're all observational studies with the exception of one. And I have these studies here, and I'll go over them really quickly. There's 3 studies in general that I think they're looking at, and a 4th study that I haven't even seen the data because I can't find it, coming out of Israel. This first one is a clinical trial. It's a continuation of the efficacy trials for Pfizer. So they've continued doing these studies to gather more data. That's pretty common. So this is based on the original clinical trials for the phase 3 clinical trials for COVID, and they kept collecting data on the participants. And they found that after 6 months, there was a slight waning of efficacy. Okay, 91% up through 6 months, and then after that, it went down to I think 84% after 6 months. The problem with analyses like this, now this is a clinical trial, so it's the gold standard. However, after a vaccine gets approved, a lot of people are going to drop out because they're going to want to find out if they had the placebo or the vaccine. And a lot of them were offered the vaccine. So a clinical trial, especially after a drug is approved, becomes less reliable because no one wants to be a placebo at that point. They want the vaccine. And you might say, well, no, maybe they were vaccine hesitant. Well, if they're vaccine hesitant, they wouldn't have been in a clinical trial. So these are folks who are going to find out as soon as the vaccine is approved, they're going to find out from the study, hey, was I a placebo? And the study is obligated to tell them. And if they were a placebo, chances are they got the vaccine. So the randomization breaks down at that point, and the results of those studies become highly reliable, especially when you're looking at efficacy. It's like a giant cohort study at that point. You're losing all the benefits of randomization. So I'm really reluctant to read too much into this without looking at more of the details. This is a study that has not been peer reviewed, by the way. It's in the pre-publication server. So we'll see what happens when they get looked at. So you can see here's vaccine efficacy. And then what I want you to look at is, after 2 months, it's 90. So at greater than 7 days after dose 2 to less than 2 months after dose 2, 96% efficacy. Greater than 2 months to less than 4 months, 90% efficacy. Greater than 4 months, 83% efficacy. So that seems to indicate waning efficacy. Again, it's hard to read. Also, another aspect of this, variants are showing up during the study. So the study, when it originally started, it was mostly the wild type, okay, the original strain. After the study started, alpha started to pop up, okay? Beta started to pop up. Gamma started to pop up. So these are a lot more difficult to interpret than you think, even though it is a clinical trial. So that's point one. Another study that looked at. This was a study done on by the Mayo Clinic, looking at cases and hospitalizations by vaccine study. Actually, no, this is the New York study. This was a Mayo study. What they looked at is, again, Waning efficacy long-term. So you can see the x-axis here is week. Okay, so from May 3rd to July 19th. So this is when Delta was starting to establish itself. This is two age groups. This is 18 to 49 and age 50 to 64. And this top group is, oh, no, I'm sorry. This is 18 to 49, 50 to 64, 65 over, and all adults. So, sorry about that. So, and this, each of the lines here, the solid one is fully vaccinated. Incidence fully vaccinated. The dashed one here is unvaccinated. Okay, this is all person. So the one I really want to look at is these two. So you can see among the unvaccinated here, I mean, the vaccinated, you're seeing increasing incidence. Same thing here, increasing incidence, increasing incidence, increasing incidence. So they're taking that as to say that vaccines are waning. That's a tough, you know, honestly, that is a really, I don't know how they could draw that conclusion. With epidemiology, what you want to do, especially with non-clinical trials, this is what's called an observational study, meaning that we're just observing what's going on. With observational studies, you always have to look at alternate interpretations. So to conclude that, hey, this is waning vaccination, that's one interpretation. There are other competing interpretations. And as an epidemiologist, we have to look at all the interpretations and weigh the interpretation that is more likely and less likely. I'm not sure that I would draw that conclusion based on this. An interpretation here could be that, hey, look, Delta, you know, early in May, Delta wasn't really established itself. Later on in July, Delta's fully established itself. So we know Delta does evade some of the vaccine. So that could just be the role of Delta. It could be what I mentioned before. New York is a highly vaccinated state. The more people are vaccinated, the more breakthrough infections occur. You know, and actually you might say, well, yeah, counts might occur, but the rates would stay constant. Not necessarily. The more virus is circulating, the rates, even on the unvaccinated, will go up because it's just simply more virus circulating. I would say that's more of a conclusion to draw from this than waning vaccine. Now, the good news here, hospitalizations. You can look at the hospitalizations. The hospitalization among unvaccinated and the solid is hospitalization vaccinated. You can see among the unvaccinated, there's almost no hospitalizations. It's doing what it's supposed to do, keeping people out of the hospital. Yes, you might be vaccinated. You might not taste anything for a few days. You might get sick for a few days, but it's keeping you out of the hospital, keeping you off a ventilator. Okay. By the way, among the young, there's nothing. Even among the over 65, you can see barely a rise here. And this is the hospitalization among the unvaccinated here, the dashed line. Vaccines are working. Another one, this is through the Mayo Clinic, looking at nursing homes and the efficacy of Pfizer and BioNTech in nursing homes throughout the country. And you can see they've calculated efficacy, pre-Delta, intermediate, and Delta. You know, any mRNA vaccine, Pfizer vaccine, Moderna vaccine, and you can see 52%, 50%. But again, this is amongst the sickest, and these are folks who are in nursing homes. They're already at a high risk, regardless of whether they're vaccinated or not, at high risk for contracting disease, especially because surveys have shown that only less than 50% of nursing, healthcare workers in nursing homes are vaccinated. So young people who are caring for them are bringing COVID to these people, to these folks. And once it establishes itself in a nursing home, it spreads like wildfire. So I don't know if this is a really good, to me, has some external validity issues to conclude that vaccines are waning. So anyways, and then finally, yeah, this one is looking at hospitalizations. Again, just hospitalizations among adults. For hospitalizations, though, again, this is interval since vaccination. With the exception of the immunocompromised, you're not seeing significant reductions in efficacy after, between 2 to 12 and 13 to 24 weeks after vaccination. And quite honestly, that's a fairly short period of time too. So, the data, and then finally, the data that I'm not seeing is this data out of of Israel that says that those who were vaccinated earlier on in December are 2 times more likely to be hospitalized than those who were vaccinated in April in Israel. Well, there's a lot of problems with that one. Number one is those who are first vaccinated in December are the sickest of the sick: seniors, people in nursing homes, those at greatest risk for hospitalization in the first place. Those vaccinated in April are much younger people. So again, without seeing the data, I don't even know if they adjusted for that. I have no clue. So this is the data that the administration is using to push boosters. I don't know if there's a scientific rationale for this. And if you talk to immunologists, they'll say the same thing, like, booster, immunologically, this makes no sense. Finally, and I think, Chris, you mentioned this, logistically, and this is the practical aspect, and this is the big one. I mean, it's nice to say that, hey, we should send these vaccines that we're not using to these other countries that don't have it. Let's send the Pfizer and Moderna doses that we aren't using to Democratic Republic of the Congo. Logistically, practically, that's a lot harder than you think, right? These are extremely difficult vaccines to deal with, to administer. It's not as easy as just sending it because we're not using it, right? So the question then becomes, okay, so we can't send them out. It's a lot harder than maybe we could send them to countries that have that infrastructure. Okay, but even then, there's a lot of loopholes that you have to go through. Meanwhile, we're throwing away probably millions of doses a day in the US because people don't want it. Why not use that for people who do, folks who are clamoring for a booster? Yeah, so that is the practical aspect. So my conclusion here, I mean, we can't just send them away. There's too many barriers here. It's not as easy as just sending them to the DRC. Scientifically, is there a basis? Maybe. I don't know. This is a tough one. But I mean, yeah, it would be nicer if we can get these doses into someone who's unvaccinated in the US, but that's a lot harder than we think. We've had basically open vaccinations. I mean, we're trying to get people, giving money to people to get vaccinated, they won't. So meanwhile, they are expiring, they're getting thrown away. Conclusion? Yeah, I don't think a third dose is harmful. Let's start giving third doses out. So from a practical matter, I think a third dose, yeah. So just so that doesn't go to waste. And there's tons of people who have already illegally gotten a third dose. So might as well let's use it. So from a purely practical level, I think, yeah, let's just administer the third dose. Otherwise, we throw it away. That's the choice, right? Give it to people with questionable efficacy, or throw it away. In that case, yeah, give it to folks. All right. I went longer than I wanted to. There was more stuff I wanted to cover, but I need to end it. I got to teach this afternoon, biostats. So thank you for joining me. I will be back next week. I will make these shorter, probably go over the global, national, local numbers more briefly, and really try to focus on this more recent news, because I think that's the important part. I'm sure there'll be more news next week, and we'll talk about what I want to talk about is the recent Kaiser survey on vaccine hesitancy, but I haven't gotten a chance to do it. I'll do it next week because there's some interesting data there, unless something else pops up that's really breaking. So otherwise, thank you very much for attending. I appreciate it, as always. And I will see you next week, same time, same place. All right. Have a good weekend, everyone.